Welcome to our 2025 Caregivers Self-Care and Tools Series number 1 webinar. I'm Delanne Elliott Midland. I am your founder, president, and CEO of the End Brain Cancer Initiative, and I am your moderator today for this event. Welcome. Dr. Courtney Burnett, she is very special, and we are so lucky to have you, Courtney. So thank you so much. I'm just going to talk a little bit about you, if I may. She is an MD and is a board-certified internist working in hospital medicine, an assistant professor of medicine, author, and motivational speaker. She is passionate about raising awareness for brain cancer, patient advocacy, and invisible illness and disability. Ooh, I like that. Invisible illness and disability. But more broadly, she works to raise awareness of our ability to embrace all of life's difficult gifts, regardless of the cause. And yes, sometimes a brain tumor or brain cancer is a difficult gift. At age 29, while studying medicine in Thailand, Courtney self-diagnosed her brain tumor, which turned out to be an incurable and rare form of brain cancer. This radically shifted her perspective on what it means to be a patient, a compassionate physician, and a mortal human being. Courtney works full-time as a hospitalist, treating adults with a wide variety of medical conditions. She is the creator of the well-known blog, Elephant Lotus Brain Tumor, and author of the award-winning memoir, Difficult Gifts, A Physician's Journey to Heal Body and Mind. Regardless of the unexpected situations life brings, she believes the power of hope, mindfulness, and vulnerable storytelling can help us all find gifts amidst difficulty. Thank you, Courtney, so much for sharing your story and helping all of us today. Not just today, you're going to be helping all of us. We're going to widely distribute this video globally. Your voice is so important to hear. I just really, really want to say thank you again for sharing and being with us today. Ladies and gentlemen, welcome Dr. Burnett, please.
Thank you, Delanne. That was a very kind introduction. I appreciate it. You make me sound, whoa, I'm impressed. Thank you. Thank you.
You're welcome.
Well, as Delanne said, that's a good introduction to a lot of my professional work, but really just more down to earth. I'm a patient living with a brain tumor, and it's changed my life. And I work and I see my friends and I do my day-to-day activities, but everything is just a little bit different with that brain tumor and the history of it lurking underneath it all. So I want to keep, every time I speak to groups like this, I'm so thankful. It's such an amazing thing that even with a diagnosis, it feels great to be able to give back and share my perspective, and I'm hopeful that this is helpful for all of you today. So we'll get started, and again, just I want to say good morning, good afternoon, wherever you're at. I'm based in Minnesota, so we're kind of early afternoon here. But as Delanne said, I'm a medical provider and I'm a patient living with brain cancer. First, I want to just thank Delanne and thank the entire End Brain Cancer Initiative team for inviting me to speak today and share my story with you all. My objectives for our time together are really very simple. First, I want to talk about how we navigate a brain tumor diagnosis, and I'll do that by sharing a little bit of my own story with you all. We'll talk about kind of how to understand that initial diagnosis, finding resources to best educate yourselves and your loved ones about it. We'll think about how to build your personalized integrative treatment team. Who should be on that team and why should they be on the team? We'll just touch the surface of comparing treatment options, thinking about standard of care and clinical trials. And think about second opinions. Do we need them? Spoiler, we do. We'll think about how we optimize time with providers. Time is always so short with a medical provider, so how can we plan ahead for our visits and really maximize our time? And then lastly, we'll think about how we can really increase our diagnostic and treatment options. Just through a quick guide, some thoughts I have through this lens of being both patient but also provider in this space. The goal for all of this is simple. And as Delanne mentioned, I think the main goal I have is how do we go from being a patient or a caregiver to being an advocate for everyone living with this illness. So we'll start by thinking about navigating a brain tumor diagnosis, which is a huge, huge topic. Now, I work in healthcare, as I mentioned, and I still find navigating this diagnosis incredibly challenging. If you are feeling overwhelmed or out of your depth as a patient or a caregiver navigating this, know you are not alone. I'll give you a very quick version of my story. As I've said, I'm a hospital medicine doctor. I live and work in St. Paul, Minnesota. I also happen to have a diagnosis of an anaplastic astrocytoma, which is a slightly rare form of brain cancer in the realm of other gliomas like glioblastoma. Now, even as a doctor, a brain tumor diagnosis is confusing, overwhelming, and very scary. This diagnosis happened for me when I was in my very last year of medical training. And it happened to be while I was studying medicine abroad in Chiang Mai, Thailand. It's a truly wild story that helped me see all of the complexities of navigating the healthcare world as a patient firsthand. I was completely amazed at how hard it is to be a patient. All of the challenges that go along with this I really hadn't thought about before. It is unbelievably hard and confusing. But I am so grateful that I had this hands-on lesson that allows me hopefully to just be a more compassionate, understanding provider with my own patients. So just about 5 years ago, a little past that now, I was in Thailand and I started to experience what I would soon decide were these small focal seizures. Luckily, my own medical background helped me quickly diagnose these symptoms and advocate for a brain MRI while I was there. I ended up having an MRI scan and finding a tumor on that scan, which was not my favorite day of the trip. I was hospitalized in Thailand for a couple of nights and then brought on an emergency flight back home to Minnesota where I would need an urgent brain surgery. A few days later, I found myself very abruptly switching from physician to patient at exactly the same hospital where I had been working in at the time. The whole thing was surreal and was a very wild story. If you're interested, it's in a book I've written called Difficult Gifts. I won't waste our time talking about it all today because I want to get into the quick facts, the things that can help us all dealing with this, but that is there for those who are interested. With all of this, I landed myself again with this diagnosis of anaplastic astrocytoma, which is a mouthful, but it's a grade 3 incurable malignant form of brain cancer. As many of you know, there are many, many types of brain tumors, all with very different prognoses, different treatment options, and different caregiving needs. Now, no matter what type of tumor you or your loved one has, I think the fundamentals of navigating a brain tumor diagnosis are all fairly similar. So that's what I want to focus on today. At the time of my own diagnosis, I found writing to be incredibly therapeutic for me. I started a blog, Elephant Lotus Brain Tumor, from my hospital bed, which I still keep writing today. It's become this patient advocacy focused blog about navigating a brain tumor journey. I later published Difficult Gifts about unexpected gifts a brain tumor diagnosis brought me, and how I found we're all really similarly navigating unexpected challenges in health or otherwise. Now, this won't be a talk about my writing or personal journey, but I mention this because I think it's vitally important for everybody dealing with a brain tumor, patient or caregiver, to have a therapeutic outlet as you navigate this new life. There's so much uncertainty that comes along with a brain tumor diagnosis, and you need something to get that out, right? Whether it's writing, blogging, drawing, attending support groups, just sharing your story somehow, I think it all helps. And sharing these stories is not only helpful personally, but is so helpful to raise awareness and hope in our community. My writing started as this little side hobby and then led somehow into a world of motivational speaking, which is how I ended up here today. I live my life now as a brain cancer survivor of just over 5 years, working full-time in hospital medicine and in medical education, but with time spent outside of that, doing everything I can to work with brain tumor foundations, cancer communities, and helping mentor others going through this challenging diagnosis. I want to support the growth of resources, awareness, and fundraising in our brain tumor world. So that's a little bit about my brief story. But luckily, after 2 brain surgeries, radiation, chemo, and some other medications I'll take for the rest of my life, I'm still here doing well with stable scans, 5 years and counting. I want to spend the rest of our time together highlighting some ideas and some tips about understanding the diagnosis and comparing treatment options. First, understanding the diagnosis. When you hear you have a brain tumor, or if you're a caregiver when your loved one has a brain tumor, your life is changed forever. But it's okay. You have been chosen for a VIP club and you've gotten your exclusive invite. We are in this together. You likely think, how is this possible? Now, sadly, brain tumors are still very underfunded and understudied compared to many other tumor types. So we really don't know how it's possible, but here it is. I'll say on the plus side, as terrible as it is, it can't spread anywhere else once it's already in the brain. So there's that. My own morbid humor helps me get through it. You might wonder then, did I cause this? How did this come about? The simple answer is no, you absolutely did not cause it. It is random. It is bad luck. As you process this diagnosis, you'll probably wonder, is this tumor curable? Sometimes it is. Sometimes it's not. But I think about it like this. I mean, we are all living this very precious, very fragile human life, which is a terminal thing in and of itself. Our time is really limited and very precious, brain tumor or not. Many of us will start to ask, how long do I have? How long does my loved one have? We have no idea. There is no clue. I think we hear statistics, we hear prognoses, and I want to remind everyone on this call that those are just numbers. Some of the best advice I ever got with this diagnosis was, any statistic that has been published in a study means that the group that statistic is based off of, they've already died. We are still here. We are not yet a statistic. So we do not know, and you are so much more than a number. I hope you never let a doctor tell you otherwise. All right, that's a lot already. I want to take a quick photo break and give you a little glimpse into my journey. So here I was in Chiang Mai, Thailand. Beautiful, beautiful place if you ever get the chance to go and visit. And I suddenly found myself hospitalized here in Thailand. I had a really interesting, different kind of hospital room than I've had here at home. But it was otherwise pretty similar. Here was on the left side, you're seeing the image I saw when I advocated for a brain MRI. And I walked into the MRI center and looked at the pictures and found my own brain tumor. And that was not a great day. But there it was, big mass in the right frontal lobe. And luckily it looks better than that now. Middle, I'm getting prepped for surgery. As many of you have seen, you get all these lovely little stickers so they can do your pre-op MRI. You see this pill box, which many of you have similar situations going on, and that's how life looks now, a little different. And then the bottom right is my really lovely colleague in Thailand who had asked a monk to stop by and help me just sort of process what I was going through with the diagnosis. Okay, it's hard to tell on Zoom, but I hope you're still awake and still with me on this journey. I want to switch gears and talk about some tips for navigating the diagnosis. In no particular order, I highly recommend all of these things. You should ask the provider diagnosing you to write down your exact diagnosis. That includes tumor type, the grade, the genetics, things like IDH, MGMT, 1P19Q, EGFR, a whole bunch of nonsense. And you don't need to worry at all about what any of this means. But having this information is absolutely crucial to getting the best recommendations. You make sure to ask for copies of your initial and all of your post-op brain images, along with medical records. It is incredibly important to keep all of these images. Now these, as you've likely experienced, these are not offered easily to you. Usually you need to call the medical record department and request these. If you ask to sign a release of information, an ROI form, when you're in the hospital or when you're in the clinic, this can simplify the process a lot. And if you end up getting a diagnosis or you know someone who's getting care outside of their home place, like I was, whether it's in Thailand, whether it's in another state, this is especially important. So make sure you're getting these images on a disc, you're getting the printed records, and you're bringing those home with you. Next, if you need surgery, as many people do with a brain tumor, ask your surgeon to preserve a sample of your tumor tissue for future studies. This is something the surgeon should be doing automatically, and if they act confused when you ask them this question, maybe that's not the right surgeon for you. On that same note, it's helpful to find a surgeon who specializes in brain tumors. Some neurosurgeons, even though they're all wonderful, they've gone through extensive training. Some specialize on the spine, some specialize on brain bleeds or other types of brain infections. If you can find a surgeon who specializes in the type of suspected brain tumor you have, likely outcomes will be better. And lots of groups like EBCI can help you find this person. Next, this one can be a touchy subject, but I recommend creating an advance directive. Sometimes this is called a healthcare plan or a goals of care document. It might feel really, really early to do this, right, when you get a diagnosis. It is not. Brain surgery is the real deal. And I would say it is incredibly helpful to have your wishes really clearly stated when you're still healthy enough to talk and write about them. This is a way we can help set our loved ones up for the future. Right? I think this is a kindness to our family, to our caregivers, even if it feels sad and overwhelming. As a caregiver, keep space and time for tough conversations like this. I think it's absolutely so important to bring hope and bring positivity, but it's also important for your loved one going through this diagnosis to know that you as caregiver understand the reality of illness and death and how scary this is for your loved one. Ignoring it won't make it any easier. It will just postpone hard conversations. Here are a few more tips for navigating that initial diagnosis. Some that are lighter than an advance directive, like building your team. We're going to get to this on the next slide with a lot more detail. Finding support services is key. That's going to be services for both patient and for caregiver. Information overload with a new diagnosis or even with a recurrence at any point through this journey is incredibly overwhelming. Groups like End Brain Cancer Initiative and other patient navigation networks can make this experience feel incredibly easier. Remember that the medical team you'll build can help with the key diagnosis and treatment options. But unfortunately, they don't usually have the time or all of the knowledge to educate you on every single available option. And they can't share the perspective of what it feels like to live with a brain tumor. Your medical team also might not always bring up second or third or fourth opinions, and many other resources you might need, like financial, social, spiritual support. All of those things require support services separately from your main medical team. I also think it's important to think about social media with a big grain of salt. There are a lot of really amazing and helpful groups on Facebook or other social media sites that are for specific brain tumor types. I think they can be great to look at. They can make you feel less alone as patient and caregiver, but there's often a lot of really poor medical advice shared there, and sometimes some not so helpful information. So do it if it's helpful for you, but not always. Next on this support realm, I think joining or finding local organizations can be really lovely. And this can maybe doesn't happen day one of the diagnosis. It probably doesn't. Maybe it's a year or 2 or 5 years in. But brain tumor nonprofits joining a local 5K events helps with this community. I think it helps to see how well many people with brain tumor diagnoses are doing out in the community when you're not just seeing those somber statistics or seeing people in your neuro-oncology clinic. I also recommend getting a pill organizer. That might sound silly and simple, but if you're new to daily medications, this is crucial. I recommend keeping a notebook or folder that's his brain tumor buddy. This is going to come to every single visit I have wherever I'm going for any doctor opinion. And last but not least here, take time to rest. Know that recovering brains need quiet, calm, and dark spaces. For some people, this is just post-surgery. For some people, this lasts forever, as surgery and brain tumors impact how our brains work and heal for the rest of our lives. Caregivers, remember here that it's not about you. If your loved one is maybe a little irritable or is not being the friendliest or easiest patient to work with, that means probably our brains just need a little nap. We'll get better. Okay, I want to get into building a great patient care team. Now, the person who diagnosed you, maybe an oncologist, an emergency med doc, a hospitalist, a neurologist, they are probably not the one that you will follow up with for your diagnosis. Who I want on my treatment team and who I recommend for most people are going to be the following. A neuro-oncologist. This is first and this is most important. Not a regular oncologist, not a neurologist. This must be a neuro-oncologist. Some rural communities do not have easily accessible neuro-oncologists. These providers are very specialized and a little bit hard to find. If your local facility does not have one, make sure that whomever you are seeing for your primary cancer care is connected with a neuro-oncologist and getting direct recommendations. Second is a neurosurgeon, again with a focus on brain tumors of your type if possible. Do research, ask patient networks like this one for their recommendations on the best surgeon. Some of us will need a radiation oncologist, at least at the beginning of the diagnosis, and know that your radiation team might be at a totally different hospital or clinic than the rest of your team, and that's okay. Radiation can come in a lot of different forms, and some places don't have the same devices as others. Next, I think is one that is so often overlooked, primary care provider. I'm a little biased as an internist. I think everyone needs a good primary care provider, but really you should have, if you have a brain tumor diagnosis, that's complex. To have an internal medicine trained primary care provider is very helpful. You can't forget the rest of your body, even though your brain is in trouble. You need a healthy and strong body to get through brain surgery, to recover, to go through chemo. If you have unmanaged conditions like high blood pressure, liver dysfunction, thyroid issues, you name it, you need all of these controlled before chemotherapy. This is not only important at initial diagnosis, but if you get a recurrence. Don't neglect your body and all these other things just because the brain is stable right now, right? Keep that recurrence, unfortunately, in the back of mind and keep the rest of your body healthy. You also want this primary care doctor to help you navigate post-surgery or post-radiation things like fatigue, med side effects. I personally worked with physical therapy and speech therapy for my bit of facial droop and some weakness I had post-operatively. So that can be helpful. Number 5 and 6, palliative care teams. Again, they can help with things like that advanced directive, but palliative care teams sometimes scare people. They do things like hospice, that's true. But palliative care teams also are just experts. They have doctors, nurses, social workers, therapists, experts with chronic, incurable illness of any kind. They help with a lot of support, they help with symptom management, and they just bring a whole different perspective. That I think is a really refreshing perspective compared to just talking about research and clinical trials and treatment and things you might get with your other providers. I also think it can be great if you feel the need to have a therapist or a social worker type therapist to help with you. A lot of palliative care clinics are directly connected to cancer clinics, and they'll have those services for you.
Dr. Burnett.
Yes, ma'am.
Quick question. Is a case manager wrapped up in this area as well?
That is a great question. Yes. So a case manager, different depending on the healthcare institution you work with. Sometimes within your cancer center, there will be a case manager or a social worker that's assigned to you. If you are in the hospital, that's a different person. But if you see a case manager kind of day to day, that's something that not every health service has. But certainly a palliative care clinic or an oncology, neuro-oncology clinic are probably the best places to find that type of person. Also can be very helpful.
Outstanding.
Yeah. And then kind of in the last few bits here, I think in this team, and again, 8+ people on here might feel like a lot, but a brain tumor diagnosis is usually not something that goes away in a couple of weeks. It's something you have for years or the rest of your life. And so this team can be built up slowly. But I think considering complementary medicine, that could be acupuncture, massage. Some patients with brain tumors like to undergo some types of cannabis therapy, all sorts of things. So talk with your neuro-oncologist, but these extra services can be helpful for some of us. Tumor board, I know we're going to get a great talk after this from a neuro-oncologist, but the tumor board is not something you need to build yourself at all. Your role as patient or caregiver is to just make sure that your clinic has one. Ask if there's a tumor board. They should know what that means. And if they don't, again, maybe you're not seeing the right people. And then the navigation networks, the support networks, people like those with the End Brain Cancer Initiative. These are such key resources to have on your team. Okay, I want to switch gears a little bit and really briefly compare treatment options. For benign brain tumors, sometimes that means just getting surgery or not and doing watchful waiting where you have scans every couple months or years. For malignant brain tumors, usually this means standard of care or a clinical trial. Standard of care is a little different for every type of tumor, but for most malignant tumors like gliomas, this will be surgery, radiation, some sort of chemotherapy, and some sort of surveillance after that. Clinical trials are very, very important, but also really complicated. They can be hard to find, and they can be really challenging to qualify for. I mention this because it's incredibly important to consider a clinical trial before starting initial chemo or before starting treatment for a recurrence, because sometimes you won't qualify for a clinical trial if you've already started a treatment. Now, that can feel overwhelming. It does for me. But remember, you don't need to find a clinical trial on your own. That is not your job. You simply need to know that clinical trials exist, and you need to make sure that your provider offers you the chance to consider a clinical trial. So let's talk a little bit about second opinions, which is always kind of a hot topic. Keep in mind, I'm going a little bit fast through this, but I want to save time at the end for questions too. So keep your questions. You can also pause me, but we can go back to any of this. But second opinions, yes. I mean, this is easy, but yes, absolutely is my answer. I'll say this, as we have all experienced, brains tend to have their limits. Even the best providers can't possibly know every clinical trial that's available or every type of treatment option, especially with how fast science and medicine is evolving these days. Different providers also have very different sample sizes. Some of the rarer brain tumor types might be better treated by a specific provider focused on that tumor type or by very specialized clinical trials. So when it comes to a second opinion, my answer is always a resounding yes. Maybe even get a third, maybe a fourth, up to you. Know that behind the scenes, your providers are already collaborating with other people in these areas. Never feel bad or worried about getting a second opinion. This is your right, and most doctors expect you to do this. Even if the plan from your primary provider is a great one, I think having another doctor agree with that and give you that stamp of approval just brings so much reassurance to the situation. All right, so circling back to this amazing network, the End Brain Cancer Initiative, the Direct Connect program Delane mentioned earlier is just a great example, I think, of how patient navigation networks can help with clinical trial and second opinion questions. Networks like these have navigators that can help you find lists of clinical trials you might qualify for. They can also help gather all of those really annoying medical records, all those annoying discs with MRIs, and have them sent to you or sent to a place where you want that second or third opinion. It makes it so much easier. I had a navigator, I still do, that I've worked with since the beginning of my diagnosis, who has helped send all of my scan results, all of my images to the provider I go to for a second opinion, and it's been so helpful. It saves me loads of time. I also did tell my own primary neuro-oncologist that I was going to get a second opinion, and she fully supported it. Remember, through all of this, you are never alone. There are so many resources like this to help connect patients and families to the top specialists and centers, advanced treatments, and all of these trials. Okay, let's talk a little bit about optimizing time with providers, all right? First, be prepared for less time than you expect, as we all can likely relate to. If your appointment is 30 minutes long, that probably means 5 minutes is a buffer, 5 to 10 minutes are with the nursing staff or the rooming staff, maybe 10 to 15 minutes are with your provider. Keep in mind, optimizing time is key. How do you do this? I would say you bring a list of questions. Write down your questions in advance of that appointment, and bring a paper and a pen. Take notes. With that in mind, bring a support person with you. It can be really hard as the patient to focus on the details of what that provider is saying when you're anxiously awaiting your results. Next, medications. Bring a list. Bring a list of new meds. Definitely bring a list of any supplements you're taking. Bring a list of refill requests. Those are so annoying when you forget to ask for the refill and then you're trying to call and get one down the road. It's hard. And ask about side effects you have questions on. Last but not least, sign up for any available patient portals. These are so helpful. They can be things like MyChart. They're called different things everywhere. But if there's an online portal where you can access results, that is key. This is, if you aren't sure where to start with a list of questions to bring in, the National Comprehensive Cancer Network, NCCN, makes a really helpful free printable guide that you can print from their website. The End Brain Cancer Initiative also has a link to this exact guide on the patient resources page, which I love. I've used it and it's a great template to start with. Things like, what tests will I need Do the tests have risks? What do I do to prepare, right? Will the test hurt? When will I get my results? All these type of things. And how do you get a copy of the results with some places to take notes? This thing is incredibly helpful. Okay, I've thrown a lot of information out at you really fast, and I want to respect everyone's time on this great call. So I want to summarize very quickly over these next 2 slides some of this key information, and then we'll leave time for questions. All right, so to summarize, here are my top tips for increasing options through diagnosis and treatment. Build your ideal treatment team. That's a neuro-oncologist, a neurosurgeon, primary care, radiation oncologist, palliative care, complementary care, and all of the great support teams and navigation networks. Record keeping is number 2. Bring that brain tumor buddy, that notebook, or that folder to every single appointment. Have that online patient portal and share your access code with your caregiver or with your loved one, because if something happens to your brain someday, you might not be able to log into that. You need to have a buddy on there with you. Keep those discs with all the images. Keep printouts of any after-visit summary or discharge summary that you've gotten and bring that with you. Next, I think connect really early with patient navigation networks. That can be right after a diagnosis or down the road right after a recurrence. EBCI is a fantastic place to start, but know that there are so many other great resources out there, and you can connect with them all. There's no limit. A few more tips here. Clinical trials, right? Consider these immediately and at any time of recurrence. Use patient networks like EBCI to help you find clinical trials. Second opinions. Get them. Get them early, get them later, it doesn't matter. Know that patient navigation networks can help you get these. Next point, again, keep the rest of your body healthy. See your primary doctor. Don't start smoking, please. Limit your alcohol use. Don't take supplements without asking your provider. This is crucial. I see this way too much in what I do. There's a lot of great supplements out there. There are also a lot of supplements that aren't approved and can damage your liver. And I have to tell you, your liver needs to be healthy to qualify for any clinical trial that will exist. So that is important. Last, but definitely not least, speak up. Your voice matters in this more than anyone else's. If you haven't heard back on a scan result and it seems like it's been a long time, call them, log on and send a message. You need to get that. If you're unsure about your treatment plan, ask more questions. Request a sooner follow-up. Remember that you are always in control. Your team is simply made out of expert consultants that you have asked to be with you on this journey. So to summarize, I hope that these tips help you move from patient or caregiver to advocate. I want you all to remember this. Share your story. It helps. It helps you going through it. It helps your loved ones. Raise awareness. Volunteer, fundraise, whatever you can do, especially right now. Sadly, almost every bit of federal funding for brain tumors is on hold because this is a rare diagnosis. So we need to support foundations and nonprofits that help with brain tumor research now more than ever. Next, find your community and share advice. You never want to feel alone in this. Remember that you are more than your diagnosis. Remember that hope is probably better than any medicine I can provide. And if you can, find the gifts in the difficulty. Thank you so much, everyone. I appreciate you listening to my story. My website is there. I welcome any questions now or later. Reach out to me anytime. Thank you all.
Thank you, Dr. Burnett. Wow, such great information, tidbits, and such a personal experience. And the way that you share it is really beautiful and appreciated. And I wanted to let people know that this is a global presentation, and we have people joining us today from Sri Lanka and Turkey and Kenya. And there's a lot of you joining us today from Canada. So hello, India and Slovenia as well. So wow, we've got a global presence, which we love, love, love. We have a question from someone you might know. I'm not sure. Hello, Dr. Burnett. Friday here, caregiver from Kenya. I am loving your presentation. Kindly address the following if possible. I'll just read the first one.
Mm-hmm.
As someone who's walked both paths, doctor and patient, what strategies helped you bridge the emotional disconnect that often exists between clinicians and caregivers?
That's a good question. And I would love to know more about that, because I do think it's so personalized for each each person. And so I heard emotional disconnect between clinicians and caregivers. I'm trying to think of some examples of that. I mean, certainly I think there can be maybe a disconnect if between what you're getting, if you're feeling as a caregiver like you're not getting enough information directly from the clinician. I'm not sure if that's exactly what you mean. I guess I'd love a little bit more clarity. But certainly, if, for instance, your loved one is going in and you're not there at the appointment with them, there might feel like there is a disconnect. And I think part of that is just sensing, whomever your loved one is. Some of us bring our caregivers or our family with us to appointments, and some people don't feel comfortable with that. And that's a hard, I think, bridge to cross, and it's very personalized. But if you are feeling a disconnect, I think it's important to talk about that first with your loved one, I would say, because figure out if it's, do I need to come to more appointments? Am I allowed to get a call? Can I talk to your clinician directly and fill in those gaps? Right? And if it's a bridge directly with the clinician, I guess I would say just feel that you have that voice. You can speak up, you can bring your questions. If you don't feel like your clinician is giving you the right answers, you can always get that second or third opinion until you find someone that fits better.
Thank you. I think sometimes clinicians are very busy doing their job, right? And I will just say this, I think sometimes they do their job and we're maybe as a patient or a care partner or caregiver, we're looking for some more emotional support.
Mm-hmm.
But we might not be getting it because the clinician is essentially doing their job, right? They're talking about the disease, the diagnosis, the treatment options, and they may forget that there is definitely an emotional bedside manner, whatever you want to call it, component to this disease. So that might be more what
that means. That makes a lot, and that certainly, I see that, I felt that. I think that is in a lot of ways provider and caregiver or patient specific. Just what support do you need? And again, if you're not getting it, different providers will have different degrees of that emotional connection with you. But you're exactly right, Dylan. I think there's a time limit. I'm not sure how it works. I know you're in Kenya, the person who asked this question. So I'd love to hear more about that. But depending on where you practice, I mean, time in the US for a provider is really, you're pushed not only by the place you work, but by insurance, by all these factors. You have a very limited time. And as much as that emotional support is needed and that extra time is needed, that's why it's so important to have this whole integrated team. Or maybe when you see a palliative care provider or your therapist, maybe then you have the 90 minutes that you need to talk about and get that emotional support.
Excellent. Excellent. I think social workers as well
Absolutely
play a big part of this. Alexandra, are you joining us today from BTN? So just to let everyone know as well, EBCI does not employ a social worker only because we don't have resources specific for that. But we do have a partnership with the Brain Tumor Network, who does employ very valuable and experienced social workers that we can connect you with. So just know that too on that side. Another question, in low resource settings or rural areas where neuro-oncologists and most of the specialists you mentioned, where'd they go? Oh, whoops, it just disappeared. Sorry. Can you see those, Dr. Burnett?
I think I'm seeing this one. It looks like some places where those specialists are scarce.
Okay.
How can caregivers best advocate for diagnostic clarity? Good question. And and certainly that's the case in a lot of the world and a lot of rural communities, especially. And I think, again, this is where it helps to get connected with navigation networks like and Brain Cancer Initiative, because even if maybe you don't have a neuro-oncologist or a very specialized surgeon for miles and miles, if you can get your case shared with that doctor, a lot of providers will offer virtual visits. So even if you can't see them in person, there may also be resources to help with financial support to help you travel to see a provider that's outside of your area. So getting involved with networks and just being very honest. I mean, asking the provider that you do have they treated this before? If they have not, to ask them, hey, who do you think we need to loop into our treatment team? Usually providers will be upfront with how many times they've done something if they feel like they need to connect with someone else for help. And that should not be fully in your hands, but also in your providers, right? If a provider knows I need extra support from someone more specialized in this, they can also behind the scenes help set that up. So it's just kind of making sure you're aware of that and asking for it.
Fantastic. We have a question that came in from a family member. They're caring for a family member and they've been caring for this person somewhere between 1 and 3 years. And it says, how to have meaningful conversation, how to not put my stress on the patient, how to support other close family siblings. And that is a really tough question, but I bet you can answer that.
Ooh, that's a big one. I'll do my best. I guess, I think some of the onus is on the person living with the tumor. I mean, certainly, right? As a caregiver, I love that you're asking this question because it shows the love and support you have for the person going through this. But certainly the person with this illness has to be in a space where they're okay talking about these things. And that's different for everybody. I can say just from my own, personal situation, I find it helpful that the more honest I can be with my loved ones about how I'm feeling, what I need from them is important. I think what helps me to be honest about those needs is for my loved ones to check in. Even if you've had, for me, example, I've had 5 years of fairly stable scans. That doesn't mean that there's a day I wake up and brain cancer is not on my mind. It's always there. And it's easy, I think, especially on days that look really good for loved ones, for caregivers to forget about that. So just to remind, to think maybe it's once a month, it's every couple weeks, whatever, check in with them, ask them how they're feeling, ask them if they have new symptoms, ask them if they just want to talk about it. I think just making space, just making it okay to talk about this maybe more often than you feel they need is really helpful.
Excellent. Excellent. We have a family member is caring for a brain tumor or brain cancer patient, and they've been caring for them between 1 and 3 years. Their question is how to cope with professional obligations, parental obligations, and caring for the loved one that is sick and not losing oneself along the way. Ooh, that's a super good question. Probably everyone here can relate to that question.
Mm-hmm.
Any advice?
That is another wonderful question. And let me think how I can best. To be frank, I am not a caregiver, right? I am for other people with other conditions, but for myself, I am seeing this from the patient side of things. But certainly when I think about who I've worked with in the medical field, other caregivers I've worked with for my own patients, it is so important to take care of your own health, right? All of these tips apply to you too. Take time for your brain to rest. Find your own therapist if that's helpful, right? Find your support team. And that might look different. That might be social support groups, that might be navigation networks, social media, what have you. But I think finding other caregiver groups, people to talk to who've had similar experiences, talks like this today, like there's a roundtable, I think, coming up. I love that idea, just to share what you need. And sometimes maybe that's with your loved one, but I think also having those support groups, having those conversations when your loved one's not there. So you can be honest, you can be open, you can talk about what you need. I tell my husband, I tell my parents, I'm sure there's a lot under the surface that you're feeling with my diagnosis that I don't know about or you won't share with me. So go get coffee, go talk about it together because that's really important.
Very important. And, along those lines, I will just be really honest and say this as a caregiver, please do not feel guilty for the time that you do take for yourself because it's necessary. Caregiving is not for wimps. And sometimes it takes every core of your being to be a exceptional caregiver. But you do need to refill and replenish and do not feel guilty about taking that time away from your loved one to do whatever it is you want to do, that will help you and replenish your soul and your energy, because you will be just a better caregiver. And truthfully, in the long run, your physical and mental health will be much better. Caregiving's hard, but what you don't want to do at the end of the day is jeopardize your own health and weaken, your own systems because you were caregiving so strongly. And honestly, I think a lot of us, when we're in the middle of caregiving, we probably don't think about that. We're very focused on caregiving. So just know it is okay to get away. It is almost like it should be part of standard of care, to be honest, for caregiving, because you have to. So just know that, and that will look a little different for every single caregiver. We have a comment by Jonathan Zung. Dr. Burnett, as a drug developer, we often find it challenging to increase awareness of clinical trials for oncology patients. In certain CNS tumors, it appears more patients are being seen and treated in the community hospital setting versus AMCs. Any thoughts on how to drive awareness for individuals and caregivers who live in the community and want to be treated within the same community?
Yeah, thank you, Jonathan Zung. That's a great question. I actually give full keynotes on this question.
Oh.
So I don't think I can summarize that quickly, but would love to talk more about it. But yes, I mean, so whether you're at more of a community setting versus a big academic medical center, an AMC, where these trials are held, for the most part, it can be very different. And how do you make people aware of it? My very brief answer is there have to be ways, I think, to get to know your patient's story. Who are the patients you hope to enroll, and how do you reach them? And that's different in every community. And that might look like making sure we have flyers, we have information in the local, more rural or community-based oncology or even primary care clinics. It looks different, whether it's just sharing resources, whether it is making sure big patient navigation networks like EBCI and others know about all of these trials and can direct people to it. Yeah, I think that's a hard one. But I guess biggest tip is understanding the patient perspective and their limitations. Why aren't they able to do this? Is it a financial constraint? Is it that they can't do this? They have to be hospitalized for a month to go through this clinical trial. They can't afford it. They can't get to it. There's a lot of things, I think, in knowing who your patients are, where they're coming from, and what they want out of that trial is vital.
Thank you, Dr. Burnett. We have a lot of questions, but I do want to get to one more, and I want to say hi, John Williams. It's been a long time. How are you? I hope he's still here. He says, thanks, Delanne and team and Dr. Burnett. This is a wonderful service for patients. Question: what is Dr. Burnett's opinion on the potential use of chemosensitivity testing of resected brain tumor tissue as a standard of care? Very good question. You were talking earlier in your talk about knowing,
Mm-hmm.
is your tumor tissue IDH1, IDH2, MGMT, what is all the stat? Okay, so here's a cool moment to elaborate on that.
Mm-hmm. Well, let me start by saying I am not a neuro-oncologist, so this is out of my scope. What I can tell you is that maybe this could be a great new thing in standard of care. And I can tell you that the more testing we have on chemosensitivity by helping people get involved in clinical trials to test these things, the more likely it will become part of standard of care. But as for if it should be, I can't really speak much to that yet, to be very honest. But I think having that data is the first step to figure out if this can be something that insurance covers. Unfortunately, that can be something that is easy to do for all people going through this surgery and getting the testing. Is there a centralized source for it? All those things I would need to ask a neuro-oncologist or researcher about.
Yes, and so standard of care is very slow to respond to science. It's about 10 years behind. And so if you ask the In Brain Cancer Initiative as a patient advocacy organization, yes. Comprehensive genomic testing should be standard of care, and it should be covered by whoever, right? So it's research information. So it could be covered by the hospital. It could be covered by your provider, health insurance. It could be covered by Medicare. We're starting to see some shifting in that area through a lot of advocacy work. So we're starting to see more coverage, and we're starting to see a little bit of standard of care for a few biomarkers, things like that. So that's a first step. So it's really, really great that we're starting to see that shift. I have no doubt that we eventually will get there where comprehensive genomic testing will become part of standard of care. But I can tell you, as a care partner or a patient or a caregiver, it does help to ask for it continually because you will be heard, right? When you're at a community setting or you're at a doctor's office or you're a surgeon and you keep asking the question, they do hear you. They do hear you. And the more you can ask, the better it is, because that creates advocacy movement, and eventually movement changes policy and standard of care. So, keep asking. Everyone should keep asking for more and more information, more and more comprehensive genomic testing, and more coverage for it as well. That information is really, really important, by the way, out of those tests, because that's a lot of times that's what's used to qualify you for clinical trials, right? For targeted therapy. So you have to have those tests, and you have to have that information in many, many cases to qualify for specific clinical trials that probably would make scientific sense for you based on the information within your brain tumor tissue. Dr. Burnett, I want to say thank you so very, very much. I'm looking, let's see here. So this is a good question, and we'll have to end it here, and we'll move on to our next speaker. This one is from Friday again, and she says, as someone who is actively transitioning from caregiver to advocate in a resource-limited setting, what advice do you have for balancing personal grief with the public responsibility of advocacy?
That is an important and tough question.
It is a hard question.
Again, because it's subjective. It is personal. Grief is personal, and how much of that and in what ways we feel it's impossible for me to put myself into what you're feeling.
Right.
But I guess I would answer this in a very broad way of, this is a bigger question than just brain tumors. I mean, think about grief through anything we're all facing, whether that's financial or social or political, and how do you balance that with advocacy? Because advocacy is so important in so many different areas, right? Brain tumors certainly included. And gosh, if we can answer that one, I think that's magic. It's beautiful. I wish we could answer that one. I think to just know that again, is, thinking back to how do you care for yourself as caregiver? To be an advocate, but to also not let it be all consuming. To do what you can, but realize that I think of it like an empathy battery. And I have so much empathy to give. I can do so much with sharing the story, with advocating. But at some point, that battery is drained, and I have to just focus on myself. And that's for patients, that's for caregivers, that's for advocate. So just find that balance, I think, even if it's little ways, whether it's, again, signing up for that local 5K or sharing a post on social media about fundraising. It can be that small, that's still advocacy. So do what you can, but if it starts to feel like you are overcome by emotion and your battery is short, take a break, right? There's only so much we can do.
Yeah, great advice. Thank you so much. Really appreciate that. Dr. Burnett has agreed to personally sign the first 10 books, the first 10 people who registered for this webinar and provided their mailing address within the United States will receive a personalized signed book by Dr. and author Courtney Burnett. I want to thank you so much for doing that. I'll get you that information. I have read Courtney's book, and I believe everyone should read it because it's true. We don't think of brain tumors or brain cancer usually as a gift. And so she has a different perspective. And so I think it's well worth reading her book as well. Dr. Burnett, a real pleasure. We got to meet many years ago in Tampa at a Brain Tumor Network event at the Society for Neuro-Oncology meeting. And I think it's there where I picked up your book, and I've had it, and I only, read it probably 6 months ago, but it's a gift, and it will be a book that I continually have within my library of books and that I get to share with people who I feel like are in need. So thank you, Dr. Burnett. Have a great rest of your day in Minneapolis or St. Paul.
Similar. Thank you. Thank you, Dylan. That is very kind of you to say. I really appreciate this. Again, right, a gift, brain cancer, brain tumors, doesn't always feel like a gift, but it's things like this. I get to be here with all of you today, sharing stories and helping advocate and raise awareness for this community. And that is a gift in it. And all of your questions were gifts. So thank you so much. I appreciate it and hope to be in touch with many of you. Take care.
Thank you so much. Thank you.